Okay, I'm going to go ahead and get started. Thank you again, everyone, for coming to our webinar, Beyond Education, Engaging Youth in Advocacy. This webinar is hosted by the California Youth Advocacy Network, and it will be hosted by myself, Nicole Morgan, and Kimberly Homer Vagadori, our project director. Just to give a little overview of CYAN, we are a statewide training and technical assistance provider. We're funded by the California Tobacco Control Program. And if you are also funded by CTCP, we offer all of these services for free, including technical assistance, trainings for your youth coalitions, young adults, and even adults on youth engagement, statewide advocacy and policy campaigns. We also offer educational materials for youth and publications and opportunities for networking. Both our youth program and our college program have strategy exchange calls. So if you have not registered for those already, that's a great opportunity to meet other people doing similar work. We have three focus areas that we work within. The first is youth. So we work with young people to increase and strengthen youth engagement in tobacco control work and specifically policy advocacy. We also work with young adults and colleges on smoke and tobacco-free college and university policies. And finally, we educate people on new and emerging commercial tobacco and nicotine products and support quit attempts with young people. This is our beautiful team. We have our two directors, Kim and Vicki. In our youth program, there's myself and Ignacio. So if you have any questions about youth work, we're the people to reach out to for that. And then in our college program, we have Alex and Crandolin. So they're our go-tos for any campus policy questions. Caitlin Maisman is our outreach coordinator and does a lot of work with new and emerging products. And Dean Paul focuses on TUPE youth engagement and collaboration. To give an overview of today's webinar workshop, we're going to be sharing some new information. So that's the webinar portion. And then we're also going to have some breakout rooms to reinforce that information, which is the interactive workshop portion. So I like to start off with that so no one is surprised by breakout rooms as we get into it. And so for an overview, we're going to start off with California's tobacco control model. And then we're going to talk about how youth engagement fits into that model. And then we're going to finish off with moving our youth engagement work to advocacy. And I'm going to hand it over to Kim, our expert here at CYN on California's tobacco control model.
Thanks, Nicole. Hi, everyone. Kim Homer Vagadori, used she, her pronouns. And I wanted to preface a little bit before we hop into the California model of how we are all working collectively to end commercial tobacco in our state and why we wanted to share this with you all today, really in this context of engaging youth in this movement. So our team is very fortunate that we get to do a lot of work with other states, and there are other states who also have youth programs. Every state really utilizes different models, and oftentimes we're asked, what does California do? How does California prioritize youth engagement in this movement? And one of the unique things about the work that is done in California, it's a very unique program in itself, but a lot of other states actually will fund youth coalitions and they will require youth work. Or they'll fund schools directly, which we'll talk a little bit about. But oftentimes that effort is really focused on engaging young people as peer health educators. So engaging youth to educate each other on the dangers of tobacco. What California does is take it a step further. And that's what we're going to be talking about today, is the larger model, not just in terms of young people, but understanding this movement that we are all part of in the state, and then why it's so critical that youth be part of this work that we're doing. And from our perspective, and you'll hear us advocate for this, but really believing why young people should be leading this work. And California's movement is well known across the world because we have very lofty goals here in our state to end commercial tobacco by 2035, which I think is still the goal. I did want to note we are not CTCP. We are a CTCP funded project. So we're not speaking on behalf of the project. We are just sharing with you something that we are well aware of and something that we also train young people on so that they understand the movement that they are part of, because we are all working towards the same end goal. So the California model is really, and I think it hopped forward a slide. No, I just put this early. Okay, so our model, we have actually multiple tobacco taxes in California. The two that we hear most about are Prop 99 and Prop 56. So Prop 99 was the first largest tobacco tax that funds many of our programs, actually most of our programs. And then Prop 56 was the voter passed initiative in 2016 that added a tax not only to cigarettes, but to other tobacco products. That money in the law, as it is written, requires that there be a group called TROC. It's the Tobacco Education and Research Oversight Committee. So TROC oversees, they're a legislatively appointed group of individuals who oversee everything that we do. Not only do they oversee what we do and how funds are spent, but they provide direction to the state agencies that give us all funding and tells them what to do. What are the priorities for this movement? What should we be focused on? So TROC is a really important body of everything that we do as part of this movement. And every couple of years, they publish a master plan. If you've never read the master plan, I strongly encourage you to do this. It's a really great tool and resource and really helps understand why we do the work that we do the way that we do it. And the way I always find this, the easiest way is to just Google TROC master plan. You can also look on CDPH's website and on partners, it's there, but the fastest way is just to Google that there. Okay, so as I had mentioned, there's Prop 99 and Prop $56. This all comes into a health education account. And then that funding then goes out to 3 different state agencies who work in different areas. So the first is the California Department of Education. So you'll hear you, hopefully, if you are working at the local level, you have partners who are from TUPE programs, tobacco use prevention and education programs. Most of us on the call, I'm assuming, are either funded through TUPE funds or through the California Department of Public Health. And the California Department of Public Health is through the California Tobacco Control Program. We also have a lot of partners at the University of California, and UC's role is to manage a program called the Tobacco Related Disease Research Program, TRDRP. And TRDRP is a critical partner as well, because we all use a lot of their research to inform the work that we do. And they all do a lot of research as well to see the impact of the work that we're doing at the community level and at the school level. And so with each of this, we all have different purposes. We all have different focuses. And so our work from a CTCP lens is it's our effort to go into the community and to engage our community partners to change our environments, to make our environments, our spaces, free of secondhand smoke, thirdhand smoke, free of tobacco waste, free of commercial tobacco products. And so how we do that is we do that through policy and systems change work. From a Department of Education perspective, the TUPE programs are funded specifically to work in K-12 schools. And oftentimes much of their work is focused on prevention. So really geared towards trying to prevent youth from initiating tobacco use. And right now too, we're hearing there's also a lot more work focused on treatment. We all know that with vaping products that we saw a significant increase in youth use of vaping. And as a result, there's a lot of work now focusing on how do we support young people in making quit attempts and supporting them in quitting. And that work is happening both on campus through TUPE programs. And then I know a lot of you are doing it. Our team is doing a lot to motivate quit attempts. We see higher addiction levels in young people right now because of the vaping epidemic. And then finally, TRDRP is focused on that research component. And so with our work in at the local and regional and even statewide level, the foundational piece of everything that we do is community engagement. So kind of the irony of this work that we get the privilege of doing is that most of our work plans focus on changing a policy of some kind or changing an environment or changing a system. But none of us can actually do that, right? Because we're funded through tobacco tax dollars. And so we can't use tobacco tax dollars to lobby. I can't, on behalf of CYN, go to a city council or go to a state legislator and tell them they need to vote a certain way on a piece of legislation. That is in violation of our law, and it's not anything that we can do. And so what we do is we engage community partners, and they go out and they do that work. And when we do this right, we not only engage them to do advocacy, we engage them so that we can hear from them and listen to what the problems are they see in the community. So then we can go do population level work, and we can change policies. And the policies we change then prevent tobacco use. They reduce individuals from using tobacco, and they motivate people in quitting. And then our end goal along the way, and this is something that, again, you're probably hearing in the field a lot when we hear language like the end game campaign, ending commercial tobacco, all of those things, is we are essentially trying to identify, why do people use tobacco? What are the causes of tobacco use? And what can we do to change systems to prevent tobacco use and to support people in quitting completely? And so why do we do all of this work? So it's really critical to frame this, that we are collectively working against a tobacco industry. Tobacco-related death and disease is an industry-driven problem. If we were to completely remove the tobacco industry today, we would remove this problem of tobacco-related death and disease, because the products that people are using that are leading to death and disease are created by large tobacco companies, vape companies, smokeless companies. They are all now one of the same. And so we are collectively not working against tobacco users or working against people who smoke. We are collectively working against the tobacco industry. And so something that we get a lot of questions on is like, well, what exactly is the industry doing? Because the industry works very hard to have a really good public perception. If you go onto their websites, they've invested millions of dollars in trying to show that they are good, they are not evil, they're really not doing that bad of things. But what we get to do, and this is actually one of my favorite things, and this is actually why I stayed in tobacco control work when I started a long time ago, was that I started to learn, what exactly is this issue and what does the industry do? So first of all, from the very start of when commercial tobacco products begin, when they are grown, it is a human rights issue. So tobacco companies and leaf companies predominantly grow their tobacco leaves overseas. There's all sorts of health hazards with workers, mostly people of color, who are growing the tobacco leaves. There's health hazards, there's child laborers, there's economic costs to this. We could go on and on and on about the justice issues that is happening overseas. And many of this is coming from American companies. I think it's important to note that. So our work here at home is stopping also what's happening abroad. The second piece is the industry uses a lot of predatory marketing to addict individuals. So they use ruthless measures both here in the United States and overseas to promote and sell their products. So they would argue that all they're simply doing is trying to get individuals who make a choice to use tobacco to use their specific brands. But really what we know, and historically we have this data from tobacco industry documents as well, is that the industry is purposely targeting, not just through advertising and marketing, but through couponing, through discounted prices, through location of products. The strategies go on and on and on. They do all of these things to addict individuals and promote their products to initiate tobacco use and then to continue it. And then finally, we know that tobacco and that the industry is responsible for, so commercial tobacco and the industry is responsible for extensive environmental impact. So again, we could have an entire presentation on this about how from the start of growing commercial tobacco all the way through human consumption is destructive to the environment. We often focus mostly on product waste, but it's important to know that even just in the first 3 months of growing commercial tobacco, the industry applies 16 applications of pesticides that go into the waterways. Many of these pesticides are not legal in the United States, which is why many of these products our plants are grown overseas. So it's an environmental nightmare. So all of the work that we do at the local and regional level is trying to shut this down, trying to stop the human rights issues that come from the industry, trying to stop the predatory marketing, and trying to stop the environmental impact. And that's not to mention what we generally focus on, which is the health impact, which is where we spend a lot of our time, is our community members and their health. And so one of the first questions, whenever we share this information with young people, one of the first questions we ask is, well, then why is this product still legal? And the simple answer is because they have a lot of money, and in this country, money equates to power. They have lobbyists. I remember years and years ago during an I&E day, Paul Neprath, who is now at the American Heart Association, he used to work at the American Lung Association. And I remember I was at I&E days, we were walking through the halls together, and somebody said something like, you know, there's really not that many tobacco lobbyists in California anymore. And as they were saying that, we're walking and Paul waves to somebody and he says, oh, that's the lobbyist for RJ Reynolds. The industry is very much present. They have a lot of money. They have a lot of power. We even see what they did here in California with SB 793 when they put a hold to that law that passed, and they put it on the ballot for 2022 and stopped the incredible work of advocates that have been at the statewide level, at the local level. So we know that this is why these products are still legal. And so with that, the industry is working really hard to normalize tobacco use. The more that we know that people are doing it, it's normal, it's just part of everyday behavior, the more likely people are start to use products. And that's inclusive of young people. If something is normal, then it feels more comfortable and more acceptable for use. And so the industry is doing this by making sure that products are in the hands of people. And so yes, they could have completely switched from combustible products. We know, and the industry knows, at least in the United States, that combustible products are starting to go away, right? We're seeing cigarette smoking rates dropping. We have incredible secondhand smoke policies, indoors, many outdoor spaces. And so what does the industry do? They introduce new products that for many locations kind of skirt the work that we've been doing by having vaporized devices. And so they want people to use it. They want people to see that others are using tobacco products. They also do promotions, advertising, marketing. You all see this all over your communities, and we're going to ask you in a minute to talk about specifically where you're seeing that. But I know that we see it on storefronts, we see it at gas stations. If you're on college campuses or near college campuses, you'll see hookah shops all over the place. So the retail environment is a major space where the tobacco industry is marketing and advertising. And then obviously we're now seeing it more and more in pop culture. And so the tobacco companies have strategically integrated tobacco into films, into TV shows, into video games, on social media. They've paid influencers to use products online. Again, all of this to normalize tobacco. And so why are norms so important? So norms are essentially just the unwritten rules or the behaviors that we consider to be acceptable. So I always like to, when I talk with young people about norms and kind of the shift of what wasn't normal to what is normal, a really great example for right now is masking, right? So think back to 2 years ago. 2 years ago, it was not normal to see an entire store of people masked. Today, it's totally normal to go out and to see people masked. So we went from shifting the norm from not masking to masking. And that in itself is a public health victory. In most places is that we have worked really hard to normalize masking. And so people feel more comfortable masking. I don't know about you all, but I distinctly remember the first time I went into a store and was like, should I put on a mask or should I not? I work in public health, so I know I should. And I put it on, but then I felt weird because I was like one of the only people wearing a mask. But now if I go into a store, I still live in a county that has a mask mandate. So if I go into a store and I'm not masked, I feel so awkward and weird and like people are staring at me because that is the norm of my community and that is the work of public health. So the challenge that we all have, especially working with young people, is that we have actual norms and then we have perceived norms. And so an actual norm in California is that we have completely normalized smoke-free indoor spaces, right? You talk to any young person that you work with, and if you were to have somebody in your indoor space lay up a cigarette or another combustible product, the looks you would get would be like, what are you doing? Why are you smoking indoors? That is not normal, because they have grown up in a state where we have adopted really strong laws and policies to ban smoking indoors. And as a result, we have denormalized smoking in indoor spaces. Whereas with vaping, we're kind of now at the very beginning of now dealing with vaping and use of these different products. And so we have this issue where we are wanting to say to young people, it's not normal to vape, but in their minds, they see a bunch of their peers vaping. And so everybody vapes. So oftentimes we'll do focus groups and we'll ask young people, how many people do you know that vape? And they'll say, everybody. I know so many people that vape. And in reality, while there are more young people who vape than smoke cigarettes, fortunately, we still have the majority of young people. It's about 80% now, a little bit more, hopefully with 2020 number decreases, that are actually not vaping. But young people think that they have a perceived norm that everybody vapes. And so again, that norm is critical, because if it's normalized, then people are more likely to try it, more likely to experiment with it. And that's what we want to try to prevent young people from doing, is initiating that use. And so when we change these norms, we change behavior. So we're going to get into a minute after our breakout rooms, or I guess 10 minutes, we're going to get into how do we change norms? How do we denormalize tobacco use in California, which is a critical component to the work that we are all doing. But before that, we want to just take a little break and have you all go into breakout rooms. And Nicole put all of the questions into the chat box. So when you get in, just introduce yourself, where you're from. And then if you have time to try to get through all of these questions, that's great. If not, just kind of start at the top and then work yourself to the bottom and just talk about, like, where do you see use and promotions in your community? Do you still see a lot of tobacco use? Who is using the products, and where are you seeing these promotions, and what do they look like? And then that last question is thinking outside of the work that we all do within tobacco control. What other companies are in your community that are promoting products? Where are they at? So the ones that Nicole and Ignacio from our team really were kind of thinking about with this question, the ones that we see all the time are sugar sweetened beverages. So like soda companies, energy companies, energy drink companies, and then also marijuana, right? So I was just on a call this morning with our partners from UC, and they were telling us that some cannabis companies are trying to sponsor the sports teams at one UC campus. They're working their ways in. So where are you seeing these? What other examples have we seen in communities? So I'm going to pause my talking now and let Nicole set you all up in breakout rooms, and you have 10 minutes. So we'll be back at 1:35. Okay, everybody, welcome back from your breakouts. Okay, so we are going to, if you have your chat open, we would love to hear, or maybe if you want to unmute yourself, we would love to hear some people just report back on some of these questions. And you can either share on behalf of yourself or just a summary of what your group shared, but it would be great to hear where you all are seeing people using tobacco products in your community, as well as where you're seeing promotions outside of, it could be in a retail space, it could be elsewhere, but go ahead and put something in the chat box, or if you want to unmute yourself and share, that would be great too. We're going to spend just a couple minutes with the report back.
Okay, I'll start. In the group section that I was shocking to hear somebody share that they had seen promotions of tobacco products on school buses. I had seen it on regular transportation, but not school buses. So that was kind of like something new for me. I can't remember where that county they were from, but someone did share that in school buses were some of the promotion that they've seen for tobacco.
Wow, thank you for sharing that. That is alarming. Yikes. Thank you. Billboards, bodegas. Interesting. Yeah, it's, you know, some of the tricks, this is why the work that you all do at the local level is so important. Some of the really progressive policies that we've had when it comes to advertising and marketing has been done through the master settlement agreement, which doesn't apply to vaping companies. And so it's really, really tricky. And that's a great question, Lourdes, about the school buses. I can't speak to it. I'm not a lawyer, so I can't tell you what is legal and not legal, but I would assume not. But if I think it would be different if it's a city bus that's transporting youth versus something that's owned by like a school district. Anybody else want to share where you're either seeing products used or promoted, what that looks like?
We talk also about, well, beside all the things that they were saying, the social media, and in our case, in Napa, how some of those businesses are trying to follow the youth, you know, some of those businesses that they show it to us. So it's crazy. And they influence in social media, movies, videos and things that, you know, especially when we talk to parents, we tell them this is a world that we don't have access to. So.
Yeah, thanks, Nancy. I think that's so important to note that a lot of the spaces that we might be in, we're not seeing it. I was just sharing when you all were in the breakout, I was on a call with our partners from the University of California earlier today, and just some of the things that colleges are experiencing now that they're back on campus. It's like a different lifetime from 2 years ago. And unless we're part of those communities, it's really, really difficult to see them. Okay, and then also Cynthia just shared that we're seeing use on high school campuses, college campuses. Yes, we are hearing that too. We're hearing that there's kind of been an uptick in students using again. There's a lot of new disposable products out there that have more nicotine, more puffs, and definitely bringing young people back to vaping, which is really concerning. Go ahead, Madison.
Can you hear me? Perfect. Yeah, I was just going to share. I'm in Shasta County, and we're seeing it like everywhere else, you know, in schools, but in middle schools. And then we actually have a few smoke-free campuses and areas throughout our community, and people just have no regard for those smoke-free areas, and they'll sit there and vape and smoke right next to a sign, and they don't care. We've actually, where I work, I'm on a smoke-free campus, and we've hired security guards to kind of help patrol and monitor that. And the security guards will sit there and vape and smoke with everybody else and just completely disregard the smoke-free campus. So it's just kind of surprising.
Yeah, thanks, Madison. I think that that's, you know, so important to know is that we do a lot of work to get these policies passed, and there's still so much more work to do for compliance. That's where all this work around shifting norms and changing norms is so critical, because we can change policies, but then we have to support people in quitting and get them to comply with the policies. And every step that we take, you know, the industry is right behind us, trying something new, promoting something new, trying to undermine our public health work.
I'd like to share the results from our group because they were really different. Most everybody said they saw promotions on social media and gas stations. What was different is that areas where there were high marijuana use, the rural areas, there was a lot of cannabis billboards. So a couple of us are in rural areas that are similar, and there was a lot of cannabis billboards, and it seemed like the use also increased. And it's hard to tell, you know, I mean, except for the smell, whether it's cannabis or you know, vaping, but there's a lot more use with, you know, different various pipes. The flyers were one thing that was really interesting to me. So when one person in our group said that she receives flyers in the mail for cannabis, and cannabis delivered. And then another community tops that. They're offering free delivery of food with cannabis products. And then the other product was that we were seeing was alcohol, even in Costco, like in frozen, you know, little frozen packages with pretty displays.
Thanks for sharing that, Karen. Yeah, it's really, you know, this is a space when we're really stuck in this crossroads of doing this incredible work around commercial tobacco, only to have marijuana and all of the promotions and marketing that they're doing. And oftentimes the populations that we all work with might be using both products. And it's hard to stay in one lane when there's such a wide lane of intersectionality with both products and the aggressive marketing and advertising. Definitely seeing that kind of everywhere. This is a whole discussion for a different call, but you know, we do have now a lot of mobile vendors that can deliver cannabis products, alcohol products, tobacco products. I'm happy to talk offline on this. We've been doing some exploring on this as well and how it kind of applies to tobacco retail licenses. But it's definitely something to watch for young people because this is what they're seeing. And somebody shared in the chat earlier that I just love and appreciated is that oftentimes we're not seeing anything like what young people are seeing. And that's why it's so critical to be having these conversations and learning from youth. They are the experts of their own communities, and Nicole will talk about that in a bit. But their reality is oftentimes different from our reality. And if it's different from ours, it's extraordinarily different from that of decision makers who really have no idea of what is happening in the community oftentimes when it comes to tobacco industry promotions and marketing, advertising, and then of course the products that are being used. So definitely encourage these conversations with young people. So now I want to hop in, and I appreciate everybody sharing in the chat and unmuting yourselves to share. I want to kind of end our discussion on this movement that we're all part of in the state to talk about the strategy. And the strategy really is to denormalize tobacco use. And so not only are we denormalizing tobacco use, but we're denormalizing the industry. We really are, we have a viable opponent. We have a very clear opponent ahead of us that we are working towards. And so we know that the lasting change in youth behavior regarding tobacco use can only be secured when changing the world in which youth grow up. So that is from the California Tobacco Control Program. And so what that means is if we change our spaces, if we create spaces where young people are not seeing advertising and marketing on the way to school, if they are not seeing people smoking or vaping or using tobacco products around them, if they are not jumping online and seeing all of these influencers using these different products and promoting them, then we are effectively changing their spaces and we are denormalizing tobacco use. But that work has a lot of components to it. And so what we're trying to do, number one, is we are trying to make products less desirable. We were really successful in that when it was coming to combustible products, and then vaping came along. And now vaping is very desirable. If you look at some of these newer products, they are colorful, they are flavorful, they taste incredible, they don't have the same smell as cigarettes. So we have a lot of work to do to make these products less desirable. But we're doing that by making them less acceptable. So a lot of the policy work of trying to limit secondhand smoke exposure, exposure to aerosol from vaping devices, all of this work is trying to make it so the products are less accessible and then even more acceptable. Even more so, the work in the retail environment, the work that you all have been doing at the local level for a number of years is making the products less accessible so that it's harder to get access to them. It's harder to purchase them. And again, this is where the industry really comes into play, and they're trying to figure out how do we get these products to people as quickly and as efficiently and as cheaply as we possibly can, because then that makes people want to use more of them. And so with this, the best way to do all of those things, again, and as we heard in that quote from the Tobacco Control Program, is we have to change our environments. We have to change our spaces. And so education is a critical component to everything that we do, but it's not the only thing. Because oftentimes, and I would say right now is really component of this, as is prior to 2018, prior to the vaping epidemic that happened, where a lot of people just feel like this issue that we work on is over. It's not that bad anymore, right? That's what we hear. I don't have friends who smoke. It's not that bad, or vaping's not that bad. And so people are kind of apathetic to it. There's other issues that are more important. With COVID, obviously, we're in the midst of a global pandemic. There are other public health priorities that are more important than this issue that we all are working on within addressing commercial tobacco use. But so what we have to do is all of this work, and I'll talk about the strategy from the state in a second, but the first thing we have to do is bring awareness. We have to make people aware of why this is an issue. And so with the vaping epidemic among teens, this was actually something that really got our community members invested again, because they became aware that young people who historically would never ever pick up a cigarette were now the ones who were starting to vape and starting to use these products. And then that brings in concern. So then people start thinking like, oh, and this is a perspective we hear a lot from parents. I thought my child would never do this, but now they vape, or they experimented with this. And so then there's concern. And now all of a sudden, somebody who just didn't think this was an issue in the past now thinks it's an issue, and they've changed their attitudes. And now there's this expectation of, well, why do we have retailers near schools? Or why do we have flavored products? Or why do we have all of these vaping products? And there's this expectation to not allow these things. And that's where, when we get that support in the community, that's where we can put pressure on our decision makers to then change policies that then change our environments. So this work, I think, has been all of this has really led the work in flavored. 10 years ago, there were not a whole lot of people talking about banning flavored tobacco. We know some of our state experts on this, Dr. Val, Carol, Phil, Gardner, all of these partners from AATCLC have been having these conversations for a long time on menthol. But it wasn't until the last probably like 5 or 6 years or so where we really jumped on and started to say, hey, flavors are an issue. That was a fail on our side from a public health perspective. We should have been having these conversations alongside our partners for a long time. But now we're all here, and we know that flavors are a problem. And the general population of adults, of voters, see this as well. And so there's a social expectation to ban flavors, and our state legislature did that. They listened to the public, they went and they adopted that. And so in theory, without industry interference, because that's what we're dealing with now, but in theory, once we change these policies and we remove the products, then it's just normalized that we don't have them anymore. And I always like to tell young people, it is my hope that now when my kids are maybe in college, they're in elementary school right now, but maybe when they're in college, they'll one day say like, it's so weird that people used to put a strawberry flavored battery pack in their mouth and vape it. That's my hope, is that we denormalize all of these products, and then it's an expectation that they don't exist. But to go through this entire cycle, we've gone through this cycle before. We did it with indoor smoking. We've done it with cigarettes for the most part. We're working on it with flavors. We're doing it with tobacco products as a whole. It takes a lot of time to do that. And so there's a combination of strategies to do this. So the first is the media. So doing educational campaigns to make people aware of what the problem is, to kind of get that knowledge out there first. You can do this at the level of general population of what the issue is. You can do this with young people to make them aware, find out the issues that young people care about so that they're aware of the problem. And then we bring in our community partners. We listen to the issues that they see. We support them and engage them to then advocate for change. And then we get those policies passed. And then we gradually start to change the norms around the products that are sold and marketed and used in our communities. And so with that, education is clearly a part of this. It's an important part of this. But from our perspective and the work that we get to do within this movement funded by CTCP is that what we are doing is population level approaches. We are trying to change communities through policy and environmental and system change. And that is done through advocacy. We have an opponent, the tobacco industry, that is trying to sell products. We're trying to not. So we have to organize our community partners, utilizing people power to influence decision makers to change policies. And once we change those policies, that's when we start to free our communities of commercial tobacco products and advertising and marketing. And that's when we start to change norms. And so policy change, though, comes from successful advocacy. I'm sure some of you can probably say on the call that maybe you just went to a city council and you said, hey, we should ban flavors in our community. And they were like, cool, great. Yeah, let's do that. And there was no fight. But I would say probably more of you would say, yeah, that's not true. It took me 4 years to do that campaign. I've worked on campaigns for 7 years. That's the longest policy campaign I've worked on, was 7 years to get a policy passed. And we did it, and we got it passed. But it took a lot of dedication. It took a lot of strategy, took a lot of organizing. But once you get there, we change the norms, we change behavior, we prevent initiation, we support quitting. And that work comes by organizing and advocacy. And this comes from people power, right? So this comes from our people at the local level who are aware of the issues, who are excited about the issues, and then they go and they advocate. And so if you are part of a CTCP funded project, you're well aware that you have coalitions at the local level. If you are not part of a CTCP program, I encourage you to get involved in your local coalition. And this is where the organizing, this is where the power comes from. This is where we all learn from each other and work together for healthier, safer communities. And so to end with the coalitions, and Nicole's going to jump into now talking about youth coalitions specifically and why we think that young people are a critical component to this work. CTCP does not mandate that you all work with young people. You all are not given extra funding to work with young people. However, we know that youth are incredible leaders in this work. We are doing this work to create spaces for them where they are not heavily targeted by the industry and where they can live healthy and lives free of tobacco, because we know that people start using tobacco before the age of 25. So this is a critical age, not only for prevention, but we also know that young people, and I don't even want to say they're our future, because they are our now, and they are incredible. And so involving young people in coalitions, learning their perspectives, learning the problems, supporting them in advocacy, and then working alongside them and our other community partners to advocate for healthy and safe communities. So with that, I'm going to turn it over to Nicole.
Thank you, Kim. We're going to start talking about how youth engagement fits within the California tobacco control model. Thank you. So once again, for CTCP funded programs, we want to be doing community work, and we want to be increasing the capacity of our community to create systems change. And that includes young people. So before we really get into it, I just want to talk about youth engagement within the tobacco control model and emphasize that it really involves providing opportunities for young people to make decisions about their communities and to be involved in the policy change that leads to social norm change, which in turn reduces our smoking initiation and consumption rates. And I also want to emphasize kind of the role of us as people who work for CTCP funded projects, full-time staff members or paid staff members versus young people. Our role as staff members is really to be the organizers and facilitators of our community coalitions and our youth coalitions, and to provide support to young people working on tobacco control efforts and working on policy change. But young people are really our community leaders, and they're the ones who should be advocating for the policies that improve their communities. And in turn, they also provide us with guidance on what community priorities are, because they are community members, and lead the advocacy initiatives. And young people are really vital to this movement, for one, because of their perspective. We talked about this a lot already, but young people are targets of the industry. And so they see and understand the problem in a different way than we do. And I was actually just working with a group last week who's getting ready to meet with the Board of Supervisors about a flavor campaign. And we're just having an open discussion about what they see in their communities in regards to flavors. And they were talking about all the marketing that they see. And I told them at the end, in the same way that you all think, yeah, of course we see all of these advertisements on our way home from school. Of course we see all of these advertisements when we go to get a snack at the corner shop after school. Oftentimes our decision makers equally have no idea that that's going on. As much as it's fact to you and it's your reality of what they see, for a lot of adults, we have no idea that this is going on if we don't work in this field. And that's why stories are so important. There's so much power in young people's stories, and it's important in a movement that's often so centered around young people and young people's tobacco use rates and protecting young people from marketing, that young people get to share their own stories. And it's our responsibility to elevate those stories instead of talking about young people and sharing statistics about young people when they aren't present. And all of that in turn means including young people in advocacy efforts and creating a space for young people to use their leadership skills, gain new leadership skills, and use their power to influence change. Okay, this model looks a little bit complicated at first, and I'm not going to go into all of it, but what I really want to emphasize here is that adults and young people should be working together to build this collective power at the top. We should all be working together as community members to empower one another and build power to create change. And you don't want on either side, right, adults to have full control over a movement and policy and meeting without making space for young people, but we also can't have young people with complete control over the movement either, especially when we're the ones who have that paid staff time to support these activities and to guide and provide scaffolding for young people. And so it's really important that we're both working together towards this empowerment and building power. And that requires a shift from thinking that young people are problems to be solved, to really recognizing that young people are experts on their communities and that they have the power to create systems change and prevent further problems within their communities. So we don't have time today to go into like the full breakdown of positive youth development theory or anything like that, but I do think it's really useful to have that understanding when working with young people. So I put these screenshots of two different resources that are on our website. This first one talks about positive youth development practices to get you familiar with the concepts. And then the second summary report talks about barriers that actual local agencies told us they were experiencing during a series of workshops, and then solutions that local agencies also helped brainstorm to those same problems. So I think both of these resources are super helpful and they can both be found on our website. And then if you already feel really confident with positive youth development, we also have a new course, Social Justice Youth Development, that we're conducting in collaboration with the University of Colorado. And social justice youth development builds upon positive youth development principles. So it also includes those principles, but it also centers justice, identity, and the redistribution of power. So if you're interested in that, we're going to start promotion for that course soon. It's not out yet, but make sure that you're on our listserv and on partners, because that's where we'll be advertising for that. And that is free too, as long as you're CTCP funded. Okay, finally, we're going to talk about moving youth engagement work towards advocacy. So once again, I know we keep putting up this image, but I just feel like it's a really good visualization of we're empowering communities to work towards that policy change and that systems change. And the work that our youth coalitions are doing should be directly tied into policy change and systems change. And what that means is that our youth coalitions should be working on items from your scope of work, because our scopes of work are written to support policy and systems change. And so we really want to make sure that we're connecting young people into those different activities in order to support the systems change. Once again, CTCP funded projects are the ones who get funding to do community work and to do the policy and systems change. And so it's really important, of course, that we want to work with our CDE partners and with our TRDRP partners, but we're the only ones getting funding to do that work. And so it's really important that that work is led by our youth coalitions, our community coalitions, that we're strengthening engagement, and that we always want to be asking, what can we do to build the capacity of our communities to advocate for change? So this, as a broad overview, is the cycle of advocacy. And on this slide, what I want to talk about is that young people should be involved in each step of this cycle of advocacy. And what we sometimes see is that that young people will only be brought in for the take action portion. So they'll only be brought in to speak at a city council meeting, or they'll only be brought in to educate community members. But we want young people to be involved in the full cycle of advocacy, because not only does that create buy-in for the policy in the community, but that also builds the capacity of young people to advocate for change in general. And one of my favorite things about my job is that not only am I working with young people to advocate for tobacco control policy and to change their communities in that way, but that I also get the opportunity to teach skills so that they can continue to advocate for change in their communities, however they see fit, with whatever policy they think is best for their community. So on the next slide, I wanted to mention that requires intentional skill building, because we can't just say, okay, we're going to involve young people in every step of the process. So go ahead, youth coalition, start, figuring out how to collect data on this problem. We really want to focus on building their skills, because oftentimes this means that we're going to be asking them to do activities that they've never done before. And so that's why this intentional skill building is really important, and thinking each step along the way about what scaffolding you need to provide to the youth coalition so that they can be successful in completing these activities. And I also want to emphasize that it's really important to have open conversations with the young people that you work with, because you want to make sure that you're not teaching them things that they already know, but you also want to make sure that you're not expecting that they know things already that they don't, and then they don't have the skills that they need to succeed. So I'm going to go through each step of this cycle of advocacy, talking about, we're going to imagine that we're doing a smoke-free parks campaign, and you all are going to be doing this in breakout rooms soon too, with different policies. So just to give you a little taste of what this looks like, the first step is to identify the problem. And oftentimes in our work, once we start engaging youth coalitions, we already have in the scope of work the problem or the policy that we're going to be working on. And so the way that you can include young people in this identification process is by involving them in the CX process. If you're not familiar with that, there's a lot of good resources on partners about the CX process. So that's a good place to look when thinking about including youth in this step. And then for the next step, we want to work on gathering information. So back to our smoke-free parks example, we're working with young people and now it's time to gather information. A good way you can do that is by doing a park observation with your youth coalition, or by doing a tobacco waste cleanup at your local parks, but really involving young people in that collection of local community data. And another point that I want to make is for researching the issue, oftentimes there's a lot of broad information on the issue already. And so what I usually do when working with young people, instead of putting together a PowerPoint that has all of that information together already, and then like standing up at the front of the room and talking about it for a long time, I like to put together research activities so that young people can actually do the research themselves, because I just find that that creates more buy-in. It's a lot more, a more fun way to be able to gather the information yourself and just listen to someone say it. And then you also want to work with them to identify a solution. And so, like Kim talked about, that's going to be a policy solution that's going to create system change in your community. And you can work with young people to kind of talk about the different options of the solution. So for example, with our smoke-free parks example, do you want it to be smoke-free park? Do you want it to be a tobacco-free park? Do you want it to be tobacco and nicotine-free? But working with young people to identify the best solution and just talking about what those different options mean. Then we also want to make sure that we are involving young people when we're developing our strategy. And what that means is that everybody's favorite portion of this process, doing your Midwest Academy strategy chart, young people can and should be involved in that process. And if you need help with that, CYN can definitely help. I've led Midwest Academy strategy chart sessions for young people before from local coalitions. I've also helped adults, kind of guided them through the process of doing that themselves. But it's really important that young people are included in this process and are leaders in this process too. And then it's time to take action. So young people, as I said, should be involved in every step leading up to taking action, because that promotes buy-in. Then they know why they're taking the actions that they're taking, and they've identified the actions that they want to take themselves, right? Because they've done that in the tactics portion of the Midwest Academy strategy chart. And so they've chosen actually the actions that they want to see out. And then finally, evaluation. And so for, we always want to make sure when we're doing policy change that our policy is having the impact that we wanted it to have. So again, if we're doing a smoke-free parks policy campaign, and maybe we did the tobacco litter cleanup back in the gather information section, you can work with your youth coalition to do another tobacco litter cleanup and see if your policy is having the effect that you wanted it to have. So for our next breakout room, I'm going to put you into groups, and as a group, you're going to choose one policy, either a flavor ban or a smoke-free housing policy. And then I want you to go through each step of this cycle of advocacy and talk about how you would include youth in each step and any skill building that you may need to provide or work with youth on in order to achieve that. So I'm going to send, if you want to take a screenshot or a picture of this, I recommend that. I'm also going to send it in the chat, but I believe you'll need to download it before you go into your breakout room. So here we go. In the chat, I'm sending a screenshot I took. And I'm about to open the breakout rooms, but I do want to ask if there's any questions before going into this activity. Okay, give me 1 second to open these. Okay, we will see you in 15 minutes to debrief. Hey, welcome back, welcome back. I heard some amazing conversations going on in the breakout rooms. I promise I'm not just saying that. So I would love to hear a share back. We're getting close on time, so let's start with one group. I'd love to hear back. Not to put anyone on the spot, but Miriam, I did see you nodding your head really excitedly when I said good conversations were happening.
Well, always highlight, I would say that I'm very thankful for all of you guys, because I know I work and I'm kind of newbie compared with Miss Nancy from Napa. She already did an amazing work, and now she gives to us a I would say or map how we can continue working by using CYNN presentations. And also, I like what she said, we don't need to reinvent it when it's already there. Love it. So I will be putting in my email from Miss Nancy, but we find out that it's we have a problems. Some for especially in here in my tribal community, it's not a big one, but function like it's a city because we have a small education department. So we have students so that I've been reaching to them, and we find out that in my area right now will be addressed that the wasting after people that are vaping, they throw away everything around the park. So this year with you guys, with your support, I received some of the educational materials and also ideas, and I did my first Earth Day, and I collected a lot of electronic devices that they don't using anymore. And that one was my first step. Right now, I'm giving to a small surveys. It's just 7 questions, easy to what they are using and age. After that, according to Nancy, I will be now try to find one person in my community that is for getting support. So thank you, Nancy. So she shared with me that. So I will be that. It's going to be my next step because I would like to see this community banned flavored tobacco will be the first step. And also in the future, we have only 15 houses that I would like to see that benefit from smoking free, but develop a policy. So looks like with Nancy, she will be share some of your PowerPoint videos, Nicole, because also I'm trying to build in my youth coalition. And right now working with my program that I'm getting. It's in my way to getting 15 tablets, and I will be provide to my community, my new members of my youth coalition. So I will be provide to them the tablet and also internet. And with Nancy and you guys support, I will be able to sharing with them your presentations. And I'm thinking like maybe put it in a pre and post small surveys from them. So we'll see if I can pass. I'll let you know, guys, when I have my first policy pass. And thank you very much. Good steps too.
Thank you.
follow.
Thank you for sharing, Miriam. I'm glad you got to connect with Nancy. Also, I know I already mentioned our strategy exchange calls, but if you're not registered, I highly recommend them because that's when we have a lot more opportunity and time to connect with one another and hear what each other is working on and learn lessons from one another. So highly recommend registering for those. And I think we're going to move on. Oh, and I also wanted to say, Miriam, I've been working full time in tobacco for just over 4 years now. And I promise, unless you've been in this 20 years like Kim and Vicky, you always feel like a newbie. I still feel like a newbie oftentimes. So don't worry about that.
I'm the newbie.
But I told her how helpful you have been, that every time I reach out to you, you always have the magic help. So
thank you very much. Okay, so for our final takeaways, the last thing, if you take nothing else away from this webinar, I just wanted to say that a reminder that our funding should be used to engage our community members and build their capacity to do policy and systems change, that young people are equal partners in policy work, and that it's really important that they're involved in policy work and not just the action portion and not just the education portion, that they're involved in every step of the advocacy process. So we have 30 seconds left, a little bit of time to do our evaluation. You can either scan the QR code and access it that way, or I'm also going to send it into the chat. So thank you all so much for coming to the webinar. I hope that this was useful for you. And I will stay on afterwards if anyone has questions that they want to talk about.
No, thank you.
Thank you.